My name's Viv Rees, and I am the daughter-in-law of Lynn Rees, my husband's father, who very sadly passed away in August this year. But for a year and a half before he died, he was fortunate enough to stay at Brackley Care Home. My father-in-law, Lynn, he had a brain injury. He had a bad fall, and he was in rehab in Leamington for over 6 or 7 months. And we looked at 3 or 4 different homes. And Brackley was actually the furthest point from our house, and it was about an hour's drive for us. And we had been looking for somewhere a little bit closer. But we did go and check out Brackley. And having looked at 3 or 4 before, when we walked in the doors, we really felt an instant connection with the place, and we felt it was just right. It was modern, it was clean, everyone was friendly, the residents looked really happy.
What particular parts about Brackley did you love the most?
First of all, Brackley actually has many different facilities, or can cater for many different types of patients. And there was a room available for Lynn by the nursing station, and that just felt really right for us because he was close to sort of nursing needs. And we also felt that longer term, if he'd lived longer, he may have been able to work his way around the home. So we felt that there were different options of level of care which would really suit him. But I suppose the main thing for us is that initially when he first started at Brackley, he was quite mobile, and he was always very sociable. He'd lived in independent living for a couple of years before his injury, and he'd really liked that social aspect. And I really liked the approach to the social interactions and activities as well that were put on in Brackley, and getting everybody involved and bringing people down to the communal areas, and the fact that he wasn't just going to be stuck in his room or stuck away from people. So in the early days, he did spend a lot of time getting involved with the activities, which have been run by two absolutely fabulous events coordinators who, I really take my hat off. And they did a lot of work to really engage with patients. And they'd not just have this schedule running, but they'd go around and include people and bring people down, and even putting them in a wheelchair to get them down for the activities, which was great. And he always really enjoyed that, and he talked about it, and it gave him something else in his day to occupy him and to keep him stimulated, which we really appreciated. It was until we sort of had him there for a while, is that the nursing care was exemplary. And he did deteriorate over the year and a half he was there, which I suppose in part was expected. But we felt, 100% confident that the team of nurses and the senior nurses were really looking out for him, and they'd escalate or contact us or contact the GP automatically if they had any concerns or issues. So we felt his physical health and mental health were being really well cared for, and he wasn't just being left as an anonymous resident in the home. So that was really good for us. Had updates from the team, and they were always pleased to see us. So we felt there's a really good connection and really good communication between what was happening for Lynn and what the team were doing, and we really appreciated that. And certainly for our impression was that that was at the highest level. So Steph, the home manager, she knew what was going on, really good communication with her senior nursing team, and right down to the care assistants who were managing his personal care on a day-to-day basis. So for us, that was really important, that it was not only a nice looking place externally, but the staff and the care that he had was fantastic. And I think testament to the quality of staff is also the lack of turnover of staff. I know that in some institutions, staff turnover is quite high, and I think that's an indicator of how happy staff are working there. And we saw, regular faces and became friendly with many of the staff over the year and a half that we were visiting him. And that was good for us because we were able to build relationships with the staff, but also it was really good for Lynn because he wasn't confused by having different faces popping up every day. So, that is, I think, a really big plus. A lot of relatives are not happy to be put into a nursing home or a care home. So if there's continuity of care, I think that makes a really big difference.
Yeah,
Okay, so Lynn was at Brackley for almost a year and a half, and during that time, we were visiting him on a very regular basis, and we really looked forward to going because we felt comfortable, we felt welcomed, we didn't ever feel in the way. We were able to get a nice cup of coffee and a nice cake or a biscuit, which didn't always help my waistline, but it did feel like a really nice place for us to go as well. And I don't think we ever felt bad about leaving, because we knew that he was, in really, really good hands. And we, as I said, we got to know and became really friendly and close to a lot of the staff who, really, really cared for Lynn. And we were with Lynn on the last couple of days prior to his death, and we'd been really given a lot of support by the nursing team as well. And they'd prepared us and really helped us to understand that he was heading towards his final moments, and we stayed with him, and we were with him when he died. And one of the nurses who really cared for him and he really liked, and I won't mention her name, but I'm sure she'll know who she is. She was due to go off shift at 8 o'clock, and he died at about 11. But she really didn't want to go home that night because she knew that she wouldn't see him again. And I said goodbye to her around the lift at about 11, about 9:30 at night. She didn't want to go because she cared that much about him that she didn't want to say goodbye. And I think the fact that many of the team who looked after my father-in-law on a regular basis, had that degree of empathy and understanding and caring, which was exemplary. It's choking me up talking about it now. But we couldn't look after him day and night ourselves. We don't have the nursing ability. We didn't have the time because we both work. But knowing that we were leaving him with the next best thing was really reassuring. And now that he has died, both my husband and myself can look back and know that hand on heart, we did the best we could for him. We put him in a place that we would very happily have stayed ourselves. And I think that it's always really hard when you can't look after somebody practically yourself. But if you can put them somewhere that you'd be prepared to live yourself and stay yourself and call home, I think that's, really, really so important. So I'd just like to sort of conclude by to anyone who's listening who looked after Lynn, my father-in-law, just like to really extend a massive thank you from the bottom of my heart and my husband's heart, because you were fabulous, all of you, for everything you did. Every time you changed him or changed his bed or moved him or turned him or fed him or microwaved a curry for him that we provided, all of those things made a difference to his last year and a half, and I can't thank you enough. And I can't imagine what a hard job it is to do every day. And I know that he may not have always been grateful for the care that you gave him, but you should always feel proud that what you do every day makes a difference to people and it makes a difference to their families. And I think if anyone's watching this video thinking about where to choose to put their relative or their loved one, those are the things that make a difference to how you'll feel about leaving your loved one in a home that is not the home that they've been in before. So that's what I really want to say is a big thank you. The final thing to add is that we extended an invitation to Steph and the team for the funeral and the wake. And my husband and I were standing outside the crematorium waiting for Lynn's coffin to arrive. And it's making me tingle now to think about it. I think it was about 9 or 10 members of the Brackley team came to the funeral, and the crematorium was probably about 40 minutes away from where the Brackley Care Home is. And I suppose the nature of the business is that there will be people passing away on a regular basis, but the fact that so many actually came to pay their respects to our dad was incredible. And that was Stephanie was there. It was endorsed by Stephanie. People were given the time off. Some people came on their days off. And I think that really illustrates how caring the people that work at Brackley really are. So, again, a big thank you from all of us and all of our family for everything you did for him. It made his death feel, much easier for us to process and to cope with. So thank you.